The views expressed on the following program do not necessarily reflect the views of Money Radio staff, management, or advertisers, and do not represent an offer to buy or sell any securities. Some interviews heard on this program may be sponsored by the participants. It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, taking stock in you, and it must be Friday, and indeed it is. We're coming at you live from the Scottsdale Air Park Studios, Money Radio 1510 AM, 105.3 FM, and the World Wide Web, moneyradio1510.com. If this is the first time you're tuning into our show is about how our older adult population can live a healthier, happier life. How do they do that? They do that by listening right here to Cypress Home Care. That's the name of my company, Health Futures. So I'm really pleased to have on in the studio via technology. I'm utilizing our ability to use Google Meet and using the phone lines. A friend of mine that I have known for a number of years, a big advocate for older adults and aging, Kathy Ritchie. Welcome to the show. Welcome.
Thank you, Bob. Thank you for having me.
It's good to have you. I've had a chance to get to know you over the years, and I've had a chance to be on your broadcast, and I can't begin to tell you how great it is to have you here with mine. So
thank you.
You have a very incredible career path, and I would love for you to share that. But I also want you to share, as we talk here in the top of the hour, your passion for the aging population and what really propelled you to really make this your journey and broadcast and really talking about aging and aging solutions. So please give us a little 411 on Kathy Ritchie.
The lowdown on me, yeah. Well, I sort of, I ended up in this space because I had a personal experience. My mother had frontotemporal degeneration. It was at a time when, the only kind of dementia most of us had ever heard of was Alzheimer's disease, people who were not in the aging space. We kind of always talked about Alzheimer's. We had heard about Sandra Day O'Connor and former President Ronald Reagan. And so it was a really scary time because it was hard to connect the dots. So, it was myself and my dad, and we worked really hard to try and support my mom and keep her home as long as possible. But FTD, if you're familiar with FTD, it's a very difficult disease.
Mm-hmm.
It's, a lot of behaviors. My mother, it was really hard to see this woman who was very vibrant. She was loved teaching people Spanish. She was from Ecuador. And she lost her ability to speak. She became very repetitive, so she had a bit of aphasia, and then she had these behaviors that made it very difficult. And when it did come time to find help in the form of a long-term care facility, it was very difficult. My mother was evicted, I want to say about 4 times, and of course, evictions seemed to happen on a Friday afternoon. Along the way. I was a younger caregiver at the time. My mother first started to change, I think, when I was in my mid-20s, 25, 26. And I ended up moving back to Phoenix in 2009. And that's when I met a dear friend, Suzette Armijo, who was in the aging space. And she was taking care of her grandmother and also raising her then 2-year-old son or 1-year-old son. And so we connected. We wanted to find other younger caregivers because it's a very different journey. You're kind of starting out and you're doing, trying to figure out your career or raising kids. In Suzette's case, we eventually started the Central Phoenix Advocates for Dementia Awareness, which was sort of a community group. And my mother had passed away in 2014, and I think her grandmother had passed away about a year before. And for us, it was a way to grieve. We really wanted to raise awareness because we didn't want their passing to be forgotten. And so we did this for a couple of years, and our goal was really to connect the dots and connect people in this space to each other, because we're very lucky to live in a state and city where we do have a lot of incredible organizations that are geared toward the aging population or caregivers. However, it's not always easy to find them. And the example I gave was just recently, about 2 weeks ago, a friend of mine from high school texted me and said her mom's husband has dementia. She doesn't know where to start. What are some resources that she can tap into? So even now, people still aren't fully certain on how to find these resources for whatever reason. And it's hard to find the information that you need. And then, heaven forbid you need something like Altex, which is very complicated. That's Arizona's long-term care.
Thank you for divining that.
Medicaid.
Yep, our state's Medicaid.
Yeah.
Thank you.
And most people can't afford, which I know we're going to talk about, they can't afford to grow old in this country. They can't afford long-term care. So my personal journey ended up becoming a professional journey when I joined KJZZ News, which is Phoenix's NPR member station. And, I around 2016, 2017, I started writing about, I pitched stories about aging. And part of it was because it's what I knew. And the first story I produced was a 2-part series on aging and intimacy. Because, older adults we're all sexual beings until the day we die. And oftentimes
Amen.
When you're in a facility, and when you're in a facility, it may be misconstrued as a behavior.
Right.
So the first piece was about, there was one facility here in Phoenix that was really trying to not look at it as a behavior and a problem, but really trying to understand what was happening. And then the second part was about a husband whose wife had younger onset Alzheimer's. I think she was in her 50s, and she forgot who her husband was. So, and he wasn't alone. And I actually did a follow-up piece with the podcast that I produced called The Recovering Caregiver, because he met someone near the end of his wife's journey with Alzheimer's, and that experience that he had. And so really, I think what I wanted to do in the work that I do is peel back the layers and tackle these issues that at the time we didn't see a lot of stories. So after that series, I was approached by an editor to produce a 10-part series. We called it The State of Aging in the Valley, and it was at the time one of the largest newsroom collaborations. And we tackled everything from ambiguous loss, male caregivers who were coming in and taking care of either their parent or their spouse, working past age 65, Latino caregivers. And from there, professionally, it really, that became the work that I was focusing on. And that was, 5 years ago, I think. And I've been following this beat, if you will, since then. And it's been really remarkable because there's always so much to do and new stories. And obviously, COVID introduced a whole new layer, really, of caregivers. I mean, really, that was, I think, the first time people were really paying attention to long-term care. What is it? What does it look like from the inside out? And that was, and the importance of family caregivers. We play such an important, often unpaid role in the long-term care space. And again, that's, a lot of ramifications with that when we are solely dependent on family caregivers. So, yeah.
Well, first of all, you and I are very similar in the sense that, we both had a tragedy happen in our lives and really propelled us to do what we're doing. And, I've often said that, if you do what you love, you never work a day in your life. And, we're looking to change the world in terms of the way they view aging and how we can age. And I know that Dr. David Kuhn says no one ages successfully, but as successful as one can age, we want to be able to do that. Kathy, it's a pleasure really having you here on the radio with me. You usually are in my seat, and you are interviewing me and so many others in our community talking about this very subject and others that are relating to aging. So I really look forward to our next 3 segments and some of the things that we're going to talk about. But thank you in this first segment just for filling in with our listeners a little bit about your backstory as to why you do what you do. So I look forward to talking a little bit more. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. We were down one segment. I got Kathy Ritchie here in the studio. She's with KJZZ, an NPR broadcast. Stick around. We will be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and if you're just tuning in, we're in our second segment here, and I'm really pleased to have here in the studio with me, utilizing technology and innovation. I have got Kathy Ritchie here in the studio with me. Kathy, so wonderful to have you. As I said in the end of the first segment, you're usually here at the mic, controlling the dialogue and the conversation. And in that first segment, you really got an opportunity to share with our listeners really your backstory as to why you do what you do. And you know, I love how you are advocating for family caregiving, and you know, I am finishing my second term on the board of directors for Duet, and you know, I believe I met you before my board of directors tenure over 6 years. You and I have been connected probably closer to 10 years, and you know, I think it's wonderful what you're doing to give back. And you know, you've been amazing with Duet. We have a relationship at Duet with Dr. Pauline Boss, who she's a rock star. She's 88 years old. And
queen, Bob. She's a queen.
She is the queen. And, you know, ambiguous loss, you know, finding meaning and hope, you know, all of these resources that she has made available to family caregivers, because she has been in that journey. Not only is she a doctor, but she's lived that journey, and she's given some great recommendations and advice to families. And every time she is put on one of these caregiving forums, you have been the person that has been interviewing her, and you've been the one that has facilitated those conversations. So I really want to talk to you a little bit more about that experience, and actually experience of really getting to know Dr. Boss and some of the work that she is doing.
Yeah, Dr. Boss is, I mean, she's sort of she's a legend, I want to say, especially for those of us who have been on the journey of dementia caregiving, because this idea of ambiguous loss, your loved one is physically present but psychologically absent, it's really hard to wrap your head around it. And I believe Dr. Boss's work really started with individuals who I think died in plane crashes. And so you never knew, like, there was, you know, fear that, like, well, maybe they're still alive. Maybe they were that one survivor. Really not having that full closure.
Mm-hmm.
But yeah, I think it was in 2017, after we did the 10-part series, you know, I had her book, and one of the last episodes we did was about ambiguous loss. And it was interesting because I had never heard of her before that, and I had never had access to her books. I didn't know of her on my own journey with my mom. Mm. And when I read it, it actually helped me with my own grief process, because you know, you oftentimes feel like, oh my gosh, I'm a terrible daughter. You know, this idea of both and thinking was a lifesaver even after the fact, because you're in this terrible, I used to call it the meat grinder of caregiving, and you want it to be over, but if it's over, then your loved one has died. So you feel terrible thinking that. And Dr. Boss she wrote exactly about that. That's both, you can both want that and still want your loved one to be present. So we did collaborate with Duet, and we hosted this conversation with us. I believe sustaining members from KJZZ participated, and we had this amazing conversation. And just since then, every time Duet hosted something, I had the privilege of moderating. And then I think our last one we did last year in October of 2021,
mm-hmm.
She was still in Minnesota because of COVID. But I was with Next Avenue, which is another aging organization, through also public media, through PBS, Twin Cities PBS. And we just had a remarkable conversation, kind of talking about this idea of myth of closure. And Dr. Boss had written a new book during the pandemic about this myth of closure, because her own beloved husband had passed away. And so she was really, kind of doing what she does best, and putting pen to paper and talking about this, because she's experienced profound loss. She lost her brother, polio, many, many decades ago, and then her husband, Dudley. And so we had this really incredible conversation, because there is no such thing as closure. And, the grief sort of changes, it ebbs and flows, and but it's always with you. So I've learned so much from her, and she was actually Next Avenue's one of their influencers in aging last year. I had the privilege of writing her bio, which was really cool.
Wow. She is a rock star in so many different ways. And, Duet is just the beneficiary of her work. And, she's already, she's leaving this legacy, this gift for Duet, and as well as the University of Minnesota. And I think there's one other university that she's left her writings and her teachings with. And, at Duet and our community here, we're just so fortunate to have this ability to help these family caregivers. And,
because it's hard.
It is. And I got to tell you, Kathy, I know I shared this with you before. We stood up Cypress 28 years ago because my brothers and I and my dad were caregivers for my mom. And we knew how hard it was. And back in 1985, when we started the journey, there weren't in-home care supportive companies. And we stood this up in 94 because we figured we could assist other older adults and their families with caring for their loved ones. And, respite is so important for the family caregiver. I don't have to tell you, and you're welcome to you're welcome to expand on this, because, so many people are focused on the person that is ill and that is dealing with the diseases, whether it be dementia or heart disease or cancer. And they forget about the partner, right? They forget about the wife, the husband, the life partner, and the stress that they undergo. And, look, I subscribe to a lot of data, as I know you do, and you and I share a friendship with, Dana Kennedy over at AARP. And AARP has some data. It goes back a little while. It's like 2013, where they have evidence-based information that shows that couples caring for one another 65 and older without assistance from family members, friends, neighbors, or professional home care companies like Cypress, 63% of the time the caregiver predeceases the care recipient.
Yeah. I mean, I've interviewed a lot of people who are on the journey. It's interesting because a lot of them are women. And I think it was looking at AARP, it was a story I'd done about daughters who are caregiving, working daughters. We often talk about working moms. Working daughters, especially, they typically pick up the brunt of the caregiving, and that often means they have to make certain sacrifices. I'm looking at I took a ton of notes, just kind of trying to, keep everything in order. But,
sure.
According to the National Alliance for Caregiving and AARP, 61% of caregivers, unpaid caregivers, are women, and they do need respite. And sometimes they're doing this alone, I think we have this idea that family always steps up, and sometimes they do, sometimes they don't. And sometimes, especially we see this with LGBTQI elders, they don't have children. So they have chosen family, but, if you're on this journey alone, you need help. And then sometimes that help costs money. And if you don't have the resources, that's an issue. And finding, I know that some organizations do have respite through volunteers, which is amazing, but there's a waiting list. I think I did a story, I think it was the beginning of this year, with talking to Duet, actually, and a couple other organizations, like Meals on Wheels, the area agency on aging in northern Arizona. And they have a huge waiting list. Like, you can't get someone to come to your house to help you with activities of daily living, which could include bathing or food shopping. Duet had the same issue, in part too because COVID. A lot of volunteers, would come from Minnesota or Wisconsin in the winter, and they would volunteer. And because of COVID, they stopped coming.
Right.
Or they were older themselves, or had a loved one who, they didn't want to risk getting sick and bringing COVID home. So this army, we rely on this army of volunteers and unpaid family members, and it's just not sustainable. And it's not always an option for a lot of individuals.
For me, the big problem solved for us and I look at it from the in-home care service side is, workforce and cost.
Ugh,
They amount this
yeah.
all costs. And I got to say this, and I know you know this too, and that is, look, COVID was bad. It was real bad. It was that 100-year or more, pandemic that we got, and I don't think any of us expected that we would have all the loss, not just physical loss, but other losses as a result of it. But truly, and I think you and I agree that the true pandemic that we have is aging. And when we have not addressed this, this was brought to light literally almost 40 years ago, back in the 1980s, really talking about, what the future was going to look like. And here we are. We keep kicking the can down the road. And
it's scary.
And it's the R's and the D's and everyone in between. They want to take care of things that are sexier, things that are more important. And, there's nothing more important than our aging population and really helping these folks that have helped change our society, built our communities, and really lived amazing lives. And we should be revering them, and we should not be, minimizing their plight. We should be giving them the opportunity and independence to stay at home and age in place if they can, and give them the resources if they can't. Well, as you can hear, we're at halftime here. Kathy,
already?
It goes so fast. I don't have to tell you, but I'm really looking forward to really digging a little bit deeper into this in the second half. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. I've got Kathy Ritchie here in the studio from WKJZZ. She'll be right back.
Now back to Health Futures, Taking Stock in You. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and we're in our second half here. And if you're just tuning in, I've got in the studio via technology, I've got Kathy Ritchie here. She is with WJZZ. It's an NPR broadcast. She has a couple other side hustle gigs that she's got going. She writes for Next Avenue.
Edit.
You edit. So you do a lot of different things, but I've got a chance to get to meet you because you are really passionate about the aging population and the work that is being done in this area, but also more importantly, the work that is not being done. And through the mediums that you work at, you've helped really shine a light on this, and that's something that's so important. And I so appreciate the fact that you are able to do that and bring such attention to what we talked about in the first and second segment, family caregivers, and how they are really feeling alone in this journey, and providing not only a spotlight, but providing resources for these families to be able to tap into to really help their loved ones through these journeys.
Yeah, I think, one of the things I want to do at KJZZ is start looking at solutions, because they're hard to come by. And I think, as you know, if you do this, you're in this space a long time, there are more tougher stories to report on than there are, there's a lot of good stories, a lot of positive stories. There's also a lot of tough stories that just, they're upsetting, especially during COVID. I mean, I think, again, I know I mentioned this earlier, and I felt like one of the first time that the people who maybe didn't have, who weren't talking about aging were exposed to it, because you had so many outlets, national outlets, local outlets, our outlet. We were talking about the challenges in long-term care. And, unfortunately, I feel like because COVID's kind of not front and center as much, neither is what has happened in long-term care. And it was very difficult when they did those shutdowns, when they locked these out. And thankfully, across the country, that's changed. Here, there was a task force to change that. And that was really important because, again, family caregivers, they were supporting the paid caregivers. They were the ones, I would go in and help feed my mom. Or, something that people don't always realize is that you have to, as a family member, take manicure and pedicure your loved ones, because that's not, you have to, otherwise you have to go to a podiatrist,
Right.
But family caregivers do these tasks that oftentimes are not done, and that's it's you don't have someone. It's very difficult. It's very difficult.
Oh, it is. And, you talked about what the pandemic did, and you talked about the lockdown. And you and I both know, we've been doing this long enough, that social isolation was already an issue. It was a problem
Yeah.
before the pandemic, and this just made it so much worse. And the deterioration that has happened to our loved ones and friends of ours loved ones and people in the community's loved ones is been nothing short of devastating. I mean, we left people to rot, and it's just so sad. We didn't know a whole lot about this disease that was wreaking havoc on our communities, but surely we've learned that locking people down was not a really good thing.
Well, it didn't work.
It
It
didn't.
didn't work, and I think it was done with the best intentions. I don't think people expected it to last as long as it did. This was a novel virus. National Consumer Voice has a lot of excellent resources on there, and they're a wonderful resource for caregivers. And I've interviewed their CEO, or their executive director rather, and there's a lot of information about the effects of those lockdowns. But I think this was something where we all came together in the task force that was done here. There were a lot of individuals who were both, you had the aging advocates like AARP at the table, and you also had individuals. I think David Vocal was on there, and he's the CEO
Yeah,
of
he's been on my show.
Healthcare
Yep.
Association, right, which represents long-term care. So I think they all realized we need to fix this, which thankfully, they came together and they were able to reopen long-term care facilities.
And the interesting thing, I've had Karen Barno on the show a number of times, and for those listeners that don't know who Karen is, she heads up ALPHA, which is the Arizona Assisted Living Federation of America, and really is a conglomeration of all the assisted living. And one of the things that Karen,
2,500 of them, we should say
2,500, of which about 2,000 of them are group homes, right, and then the rest are facilities,
centers. I think.
But one of the things that she said, and it's so true, I mean, assisted living has only been around about 25 years. I mean, I talked about in-home care. When my mother was sick in 1985, there weren't home care companies. I mean, we stood up Cypress in 1994, and that happened to be the same year that Home Instead started, and they've got 1,200 locations worldwide. So, I mean, there just weren't these resources. And Karen said it best. She said, we made it really clear when we got into the assisted living business, we were going to be the social model, not the medical model. And, this pandemic caught us by surprise, and we had no federal dollars coming to us like Dave Opal's, entities, which, had federal access to federal dollars and federal
CMS regulated.
Yeah, CMS regulated, and they got PPE and
the ALs did not.
And the ALs did not. And they didn't even know how to put it on and take it off. So, I mean, look, we learned a lot through all of this, and it was very painful what we went through. But I think we're in a better place. But I want to carry our conversation onto something we ended the first segment on, and that is workforce and certainly dollars, and how do we pay for care. CMS, came out with that announcement in April of 2018 that they were, Medicare Advantage was going to do in-home supportive care. But I'm here to tell you about 21%, 22% of the long-term care providers of Medicare Advantage, or should I say the Medicare Advantage providers, are offering this benefit. But the benefit is anywhere from 40 to maybe 100 to 120 hours per member per year. That's it. So.
Wow.
So really what it's offering is transitionary care from a hospital or a skilled nursing setting back home, but it's not ongoing care like long-term care insurance pays for, or veterans benefits pay for, or private pay pays for. We've actually moved. I serve on the board for the Home Care Association of America. We're out of Washington, D.C. We've actually moved from private pay to family funded, because we're finding, especially in these times when we're sitting down with families, oftentimes it's the children that are helping pay for their parents' care. Yeah. Because the parents, we're living such longer lives now that they don't have the resources, and they lived on fixed incomes. And how do we care for our loved ones? Well, a lot of times the family members are pitching in.
It's interesting because this is an area that, because of my own experience, it scares me. It takes, I don't think it worries me that, I think if you ask the average person, like, what do you have in savings for retirement? I mean, you need at least $1 million.
You do.
If you stop working at 65 and you live another 20, 30 years and you want to maintain a certain lifestyle, $1 million. I did a story on this. I was talking to, I'm going to look up his name because I put it in my notes. It was, oh gosh, I'm probably not going to find it.
As you're looking it up, you mentioned that you and your husband bought long-term care insurance, and you're one of the few that did. I did back 19 years ago because I knew I couldn't even afford my family's own company's services.
You don't get a discount?
I would get a discount, but I don't know how long it could go.
I think people, I learned this with my mother. My mother, she actually did qualify for all tax, thankfully, because even a group home, it's several $1,000s a month.
Right.
And, if you're in a place as memory care, you could be looking at, I think $7,000-$8,000 a month. Most people don't make that in a month.
Yeah. No, so, and listen, let this be a wake-up call. We're coming at you, to our audience. We're coming at you through Money Radio. This is a financial news network. And this should be a wake-up call for everyone that's listening. If you don't have the resources, you better start accumulating them, because you know what? If you're going to retire, we have no idea how many more years you're going to live, and long-term care is expensive. You gave a couple $1,000s. Here in Scottsdale, you might be able to find something for as low as $3,500 to $4,000 a month, all the way up to $12,000 a month. It is crazy scary. In some of these communities, you have to buy in, and that buy-in can be as much as, it's called a life care contract, and you could buy in for as much as about $1 million.
Yeah, and don't forget, things are a la carte sometimes. So you're paying your base, and I know we've got to run, but then you've got other things that you pay more money for. Well,
we're down 3 segments, Kathy. We got one more to go. Stick around. You're listening to Health Futures. I got Kathy Ritchie in the studio. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and if you're just tuning in, we're in our 4th segment here. And I've got Kathy Ritchie here in the studio, coming via technology. She's with KJZZ NPR broadcast. She also edits for Next Avenue, and she's a friend of mine I've known for at least a 10-year period. And I've had the honor of actually being interviewed by you, Kathy, and it's really nice to be on the other side here interviewing you instead of you interviewing me. And we talked at the very, very end of the 3rd segment. We talked about, cost, and certainly one of the things that you were looking for some information from an individual, David John, I think was the name you discovered. He's a senior policy advisor at AARP Public Policy. What was revealing from what he shared with you?
Well, it's, I'm always curious about the number, right? Like, how much does one need? And David, obviously there was it depends, but what he told me in our interview, and I did this with KJZZ a couple of months ago, he said the typical rule of thumb is that you want the combination of your Social Security benefits and your other resources, if you have other resources, to equal somewhere in the neighborhood of 75% of your pre-retirement income. So, if your income is like $60,000 a year, you might want your retirement income to come in around $45,000 a year. That is a lot of money for some people, and that's the math. And it's very scary, and that's assuming you don't have medical debt. I mean, something I think we were talking about too is the fact that many older adults will develop a disability as they age,
Mm-hmm.
and that is very expensive. And so that is something that Next Avenue is exploring right now in a 12-part series called Aging and Disability, and it's very challenging. Part of it is also looking at what happens with individuals with intellectual and developmental disabilities as they age. For example, individuals with Down syndrome. Was 30, 40 years ago, I think the life expectancy, I want to say, was age 30.
Mm-hmm.
Now it's 65, 70. And our society just isn't there for these individuals to age. There are very few places that do both, caregiving for somebody with a disability like Down syndrome, and while they're aging at the same time. I actually did a story about this, and I interviewed a lovely family here in Phoenix, and their daughter is 55, and they're in their 80s, and they're her caregiver.
Wow.
They're taking care of her, and she has, Down syndrome, and she's in her 50s, and they're in their 80s, and it's just like, this is the reality for a lot of Americans.
It is.
It's just it's a fact of life. We don't talk about it, and we need to start talking about these aging issues because they're complicated, they're messy, and they're expensive.
And that's why I say it's really the true pandemic that we're dealing with as a society. And when you really look at bankruptcies, right? And I know you've probably touched on this too. Over 40% of American bankruptcies are because of medical bills and aging bills and everything that comes along with healthcare. And we still have an issue. Health insurance. The Affordable Care Act. Was a good first start, but long-term care is something that isn't sexy. It's not sexy. Nobody wants to talk about it. But
well, you don't see it. Like, you pay all this money, and you're like, where is it going?
Exactly. Well, you said it yourself. You and your husband bought a policy. You're not sure how long you can keep it and enforce it. I am telling you, don't ever let that go, because you got lifetime benefits there, and you've got a young daughter, right?
I do.
And you know what? You don't want her to be burdened with caring for you and your husband.
And that's why we did it.
Exactly.
And we're fortunate that we could do it, but it is expensive. And there have been times where I'm like, well, what if I don't need it? You think about these things, but the reality is, I can't read the tea leaves. Aging is very expensive. You don't know what disabilities you might develop later in life, or what might happen. And, so many individuals, their house isn't paid off, or they don't own their home. And then there's that very scary gap of like 50 to 65. If you lose your job, you can't get on Medicare yet because there is that gap, right?
Right.
And I've done some reporting with homeless seniors. You're in that funny place where it's hard to get a job. It's hard to get a job with good benefits. And then, you don't qualify for Medicare. It's a very precarious time, I think.
No, it is, but we are hopeful. You and I talked a little bit at the break, and I've talked about it here on the show, and that is, we have some people that are stepping outside the box, and the state of Washington's a great example.
Mm-hmm.
They created this Long-Term Care Trust Act that was created actually before the pandemic. It was supposed to start, I think, here in January 22. I think they delayed it to January 23, and
they had some bugs I think they were working out. It's controversial.
Well, it is very controversial, and we still don't know if it works. The actuaries have looked at it. They've examined it. I think one of the greatest things that the governor really pushed forward was, look, you don't have to pay this tax if you go out and buy your own long-term care insurance. So it really it pushed the envelope. But I also know people that live in Washington State, and they're like, you can't even find long-term care insurance because everyone is so busy trying to buy it themselves. So, and there's so few providers today of that. When I joined the Governor's Advisory Council on Aging, we had a list of all the long-term care insurance providers, and it was like literally 5 pages long. And I wasn't on that board for more than 4 years, but at the end, it was like less than a page and a half, because so many of these companies are no longer existing. They've closed down because they can't make the math work.
Right, and that's so much of it. And I know Governor Ducey in May signed something to have like a study group to look at something with for people who don't have access to a 401k with their employer, I think it would be like an IRA situation. So we'll see, and I think we have to, I think having bold action like what they did in Washington, I think it's interesting. I know it's controversial and it's painful, but from my reporting and what I've seen, our model is not sustainable. What we have in place is not sustainable for me, for people. And, and if you think about it, I'm Gen X, right? I was born in 77. And the earlier Gen Xers, they're in their 50s now.
Right.
So they are there. And, we need to talk about this. This isn't just baby boomers. And forgive me for using that term. I know it's not very popular, but for individuals 65 and older, Generation X is there. If you're 45 and you don't have things, I would be scared. I would be very scared because there's a lot that can happen between now and when you can potentially access certain benefits.
So, Kathy, you hear the music. We've got, maybe 30 seconds or less.
Okay.
Any last thoughts you want to leave with our listeners? Maybe a question I haven't asked.
I really talk about this. I encourage everyone to talk about what are the family plans. Talk to your parents. Talk to your spouse if you have children. Like, what are we going to do? I think there's a lot of, there needs to be conversations about if something happens to me, do I want to go into a long-term care facility?
That is such great advice. And it's just not one conversation. It's an ongoing conversation.
It's ongoing, and it's important to talk about aging. It's important to talk about that.
Kathy, we have to go. Great having you. We'll be back next Friday. Take care. Thank you, Kathy.
Thank you.
Make it a great day.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.